if a male has a low sperm count or low motility or abnormal morphology, is there a treatment? The treatment usually is take the sperm, put it through a sperm wash procedure, which is basically taking the sample, you put it into a centrifuge, it spins around real fast. Sperm actually weighs something, so anything that has weight, like male or female chromosome sperm cells, will get pushed to the bottom of a test tube. Then we just take those live cells and put them through a little tube into the female cervix and place them intrauterine. So we call it IUI, intrauterine insemination. But short of that, is there something that can be done to cure this low count or this poor morphology or this poor motility? Most of the time, you really don't find a reason to explain it. A lot of it is genetic. Sometimes the male will have what's called a varicocele, which is a dilated vein in the scrotal sac. That dilated vein brings extra blood into the scrotum, increases the heat. That heat does damage sperm. That's why the testes are outside the body. The ovaries are inside the body in the female. So another factor that could cause these issues is environmental factors. A guy who smokes, excessive alcohol, or radiation exposure, or other toxic exposure, these could explain abnormalities in sperm. So we do recommend that men quit smoking or avoid excessive alcohol, since they will have an effect. The life cycle of a sperm is about 60 to 70 days. So if a guy, say, has a bad fever or the flu today, in about 2-3 months from now, that's when you're going to see the damage. So that should be transient and it should improve, but any kind of insult that happens to sperm production today, you're not going to see for 2 months.